On Wednesday, May 12th, Maryland Governor Larry Hogan announced that effective Saturday, May 15th, all capacity restrictions would be lifted for restaurants and bars, as well as outdoor and indoor venues for art, entertainment, sports, and conventions. Indoor masking requirements will still be required, however. Ron, predictably, Montgomery County Council Vice President Gabe Albornoz rejected the governor's lead. Why do we think of Montgomery County that we're the smartest people on the world? And does Health Director Gales think that he's that much smarter than everybody else in the state?
Well, I think if you ask most Montgomery County residents, we all might be willing to concede that we are smarter than everybody else, not just in the state, but in the entire country. But I think, look, honestly, I think everybody's still a little trepidatious about what we can expect with large mass gatherings, whether they're indoor or outdoor. And I don't know if they think that the science doesn't support opening up to that quantity. I mean, jumping from the restrictions that we've had into full-blown, everybody's free to do whatever they want, is quite a large step forward. And we know that Montgomery County has historically not walked lockstep with Governor Hogan or Governor O'Malley or many governors, that we've had in the past. We just typically do our own thing.
But it's also it's a philosophical thing too, isn't it?
Of course it's philosophical. I think, Republican leadership on the coronavirus issue has been sketchy from the top and has gotten progressively better as it's filtered down to states. But I think there's still this underlying fear that the Republican perspective on the coronavirus isn't as seriously taken as it is with, Democrats and liberals across the country.
Well, Laurie, I'm sure you want to rebut that, but 57% of the county residents have received their first dose, and the number of new cases at the lowest in a year. Now, I know the county has this metric that we have to get to 60% before we dare open up any further, and their grand plan says we won't open up until June. But can't they be a little flexible on this?
Ron said it earlier. He said underlying fear. And I think, when Democrats are more run by their fear, Republicans are not. They look at the science and reality. So I think when you look at what Elrich is doing, is he's got a little bit of tunnel vision there, and he's looking at, he talks about the infection rate and how it's the lowest in Montgomery County among most of the jurisdictions in the United States. Well, there's a lot of other things you got to look at besides just the infection rate. He's got that tunnel vision looking at just that. We have a 7-day average in Montgomery County of 4.1 cases per 100,000. That's fantastic. We have a 1.8% positivity rate today. That's fantastic. It's time to open up along with the state. The state has done just fine with the Hogan decisions up to date. Maybe they're a little bit higher on the metrics, but Maryland has done extremely well. And if they're going to open up all of their businesses, why can't our county do this?
Well, here's the dichotomy, and then we have to go on to another subject. Part of this is that Montgomery County just received a big chunk of money, from the state. And they're going to allocate $300 million to helping restaurants. Well, restaurants really want to be open. They don't want help. They want to be open. But we got to go on to this next part because, Laurie, Governor Hogan announced that young teens between the ages of 12 and 15 are eligible for the Pfizer vaccine. But aren't there questions as to why young people need to take the vaccine, and is it safe?
Yeah, there are a lot of questions about it. We've just heard now that the Pfizer vaccine is eligible, that kids can now get it, age 12 to 15. But I don't think it should be required for young people to get the vaccine, but the Johns Hopkins, when I went on their website, they do recommend that this age group does get the vaccine. It not only protects them, it protects other people who may not have gotten the vaccine or who may be more susceptible to get it, even though if they had the vaccine, they might still be infected. It's probably not going to be as bad, but still, I think it's a good idea for young people, but it's a decision that people need to make for their kids, and the kids at that age could also also be involved, I think, in trying to decide with their parents on what to do. But it's safe, and only one child in the state of Maryland has died directly from COVID. So the chances of dying is extremely, extremely low, probably higher for.
Well, I want to roll.
So.
Thank you, Laurie. I want to finish up with Ron on this. Is it safe, Ron? And have we come to the conclusion that we just have to live with it? That we're going to have to live with COVID the rest of our lives?
No, I think that that's ridiculous. And, I want to not backpedal, but go back to, Republicans and science were definitely not merging during the past 4 years, particularly during the last year. So the idea that, Democrats are a little bit more timid, I think it's cautious is the more operative term. We want to make sure that the citizenship at large has all of the information that they need to make decisions for themselves, whether it's good information or bad information. And I think children, by and large, should be vaccinated because of the populations they cross with so frequently. It's a good idea as far as I'm concerned.
Well, we're going to have to leave it there.